we're here to do the skin assessment. I have Carmen with me. She's going to be assisting me. Carmen, do you give me consent to show this for educational purposes?
Yes.
She does give me consent. She is over 18, so we're going to go ahead and start. I'm going to pretend that I'm walking out, and then I'm going to be walking back in for these skin assessments. So I'm walking out. So I'm going to pretend that I'm coming in the room. I'm going to knock, 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 knock. I come into the room. I close the door for privacy. I'm going to go ahead and put hand sanitizer at this point. So I'm putting some hand sanitizer. So I've provided privacy. I put hand sanitizer. I'm not going to use any PPE. I'm going to go ahead and introduce myself, and then I'm going to verify the client's ID. So, hello, my name is Jasmine. I'm a student nurse at the Texas A&M University, and today I'll be doing a skin assessment. This would include checking your skin, color, texture, toger, nails, and circulation. I will explain each step as I go. Do you have any questions before we begin?
No.
Okay. At this point, I'm going to go ahead and check your name. Can you please tell me your name and date of birth?
Yes. My name is Carmen Saavedra, and I'm from January 14, 1975.
Thank you. So I'm going to go ahead and inspect skin color. I'm going to look at exposed areas like your palm, your soles, just to note for cyanosis, pallor, jaundice. So I'm going to go ahead and start inspecting. Can you show me your palms? All right. I'm going to go ahead and check your back. All right. So I don't see any cyanosis, pallor, jaundice, or redness. Now I'm going to go ahead and move to the next step, which is head and scalp. I'm going to inspect your scalp for color, hair distribution, lesions, infestations. I'm going to go ahead and check, okay? All right. So your hair distribution looks even, your scalp color is normal, and I don't see any lesions or infestations. I'm going to go ahead and move to, I'm going to check any moles or any bruises. So I'm going to go ahead and inspect your body for that. So you have a couple of moles there. All right, so the moles present are small, round, uniform in color, no abnormal bruising or vascular patterns noted. I'm going to go ahead and check for temperature, moisture, or texture in your upper extremities and your lower extremities. I'm going to go ahead and palpate your skin, which is, I'm just going to touch it with the back of my hands for temperature, okay? Okay, now I'm going to, if you move your hands to the side, I'm going to go ahead and see. Okay, so it feels warm, dry, and smooth, which is within normal limits. I'm also going to check your skin toger for dehydration, which is I'm gonna be checking your skin and pinching it gently over your clavicle. If it returns quickly, it means that you're well hydrated. Okay, so I'm gonna be pinching right here. Okay, good. So returns quickly, which means you're well hydrated. Now I'm going to move to the body, your body hair distribution. I'm going to observe your arms and legs. So, all right. So I'm inspecting your legs and your hair distribution. In your hair distribution, the hair is evenly distributed with no unusual loss. Now I'm going to go ahead and move to the next step, which is wounds or lesions. I'm going to inspect for any wound in your upper extremities or lower extremities. So I'm going to go ahead and check. So I don't see any open wounds or drainage. Skin is intact. The next step is that I'm going to be checking for edema on your lower extremities. So I'm going to be pressing over your ankles, chins, and just seeing if there's any edema, okay? All right, so there's no edema present. Now I'm going to be inspecting your nails and the bed nails, the bed of your nails for any color, for any color discoloration or any clubbing. So I'm going to perform capillary refill. I'm going to be pressing gently. Okay. All right, so there's no signs of clubbing. Capillary refill is less than 2 seconds, which is normal. Now I'm going to be looking at the posterior part of your body to inspect for any wounds or lesions. So I'm going to be looking in the back of your on your back and in your heels and just around your body. So I'm inspecting the posterior part of your body, your heels. See if you have any. So there's no blanching or redness areas. Which indicates good circulation. And I think that concludes my skin assessment. Thank you so much, Carmen. Everything looks good. Thank you for assisting me today.
Thank you.
Thank you.